We're going to discuss sports medicine as a general term and all of the areas that would fit under the umbrella of sports medicine. So it's a very broad field of medical practice related to physical activity and sport. The American College of Sports Medicine, also the ACSM, is one of the professional organizations dedicated to the health and safety in sports. And then the National Athletic Trainers Association, the NATA, is the governing body of the field of certified athletic trainers. The umbrella of sports medicine fits into two main categories, which is performance enhancement and injury care and management. So enhancing performance would include exercise physiology, biomechanics, sports psychology, sports nutrition, strength and conditioning, personal fitness training, coaching, and basic physical education. Where the injury care and management side is the practice of medicine, the field of athletic training, sports physical therapy, sports massage therapy, sports dentistry, osteopathic medicine, orthotists and prosthetists, sports chiropractics. The sports medicine team is involved a number of individuals who perform specific functions relative to caring for the injured athlete. You should meet prior to each school season to discuss the protocols and changes from the previous seasons. You should define the scope of practice of each member, review emergency plan and roles. Communication is necessary and should be communicated, and decide how aggressive the team will be. So within the sports medicine team, you would like to have fitness professionals, recreation specialist, an athletic administrator, coach, a physical therapist, or an athletic trainer, a team physician, the athlete, and maybe your family members. So the physicians made up within this group could be dermatologists for skin conditions, gynecologists for female health issues, an overall health physician, an internist for internal organ health, a neurologist for physicians within the nervous system, ophthalmologist, eye injuries, orthopedic for muscle, joint, and bone, osteopath for manual therapy, pediatrician if you're dealing with children, and psychiatric medical professionals for mental illness. So the sports medicine team should include your team physician, your certified athletic trainer, your school health center or nurse, a dentist, podiatrist, a chiropractor, orthotist, sports psychologist, any physical therapist, again a nurse in the health center, strength and conditioning coach, an exercise physiologist, a biomechanist, nutritionist, massage therapist, an EMT, equipment personnel, referees, if you have all of these entities. If not, you pick the entities that you do have. The role of the certified athletic trainer is preventing injuries, basic first aid, injury management, evaluating injuries, rehabilitation, safe return to play, communication with coaches and physicians, record keeping and administration of paperwork, and organize the sports medicine team. The role of your team physician is to assist with health examinations, diagnosing and treating injuries that are referred to them, illness care and possibly medication needed for treatment of illnesses, advising the certified athletic trainers, game coverage when necessary, especially within football, and counseling athletes on basic health matters.